In this video, we'll be showing a case of IOL exchange for Uveitis-Glaucoma-Hyphema Syndrome. The patient had repeated bouts of loss of vision, wipeout, classically seen with UGH, that was investigated by neuro-ophthalmology. They couldn't find anything systemically wrong with the patient, and once we saw her, we did a UBM and found a significant Soemmering's ring, which we feel was the cause of her symptoms. So we decided to do an IOL exchange, place a 3-piece lens in the bag, and remove all of Soemmering's ring. So here we're dissecting the lens out from the capsular bag. The surgery had been done a few years back, so there was a little bit more fibrosis around these haptics and around the terminal bulbs of these haptics. But we were able to remove the whole lens without causing any undue stress to the bag. And again, here doing the more temporal haptic, which is often a little bit more tricky. In this case, using a Kuklin hook and a Sinski hook to really mechanically separate the adhesions from the haptics. And then we cut the lens into 2 halves using some 19 gauge scissors while holding the lens. Once we get halfway through, we re-grasp to get a better hold on the lens and then cut it into 2 and remove these halves completely, leaving the capsular bag empty, aside from the Soemmering's ring, which we then used a vitractor to remove the Soemmerings that was left in the bag and that developed after the cataract surgery. So here we're really pulling on these Soemmerings, carefully dissecting them off the bag, again avoiding any traction to the residual zonules. We're not doing a lot of cutting either. We're using mainly the aspiration of the vitractor to pull them out from the equator of the bag and then bring them more centrally. These are typically very hard to remove. Soemmering's ring is friable and it can break up quite easily. So we really want to try to aspirate it out away from the bag. And we're going to go over 360 degrees here to really remove all of the lens epithelial material that we can to avoid any Soemmering's ring from happening again or reproliferating. And so it's just basically a massive cleanup that we're doing of the bag. And to avoid this from happening again, we preferred placing a 3-piece lens in the bag with these smaller haptics. We could have placed a 1-piece lens as well, but we thought that maybe for these smaller haptics had less of a risk of causing any issues with the posterior iris. And here we see it fits quite nicely. We put in a couple of istents as well because the patient had higher pressures on. They were relatively controlled on drops, so we wanted to get her off the drops afterwards. What happens often in these cases is the trabecular meshwork does take a bit of a hit from the Uveitis-Glaucoma-Hyphema Syndrome, so bypassing it does help. Then we manually remove all the viscoelastic, and this patient did quite well, getting 20/25 vision at the end and a resolution of her UGH. Thank you.